My name's Caleb Stradiger. I am a rising senior at Ohio Northern University studying mechanical engineering with a concentration in aerospace. And my project is spaceflight deconditioning countermeasures. And initially I came here for investigating methods to minimize the gap between pre and post spaceflight syndrome. So, what does that mean? What do astronauts experience in space? Well, they actually experience a 20% decrease in muscle in only a span of 2 weeks. You can actually measure this through mass, the mass of the muscle and the strength of the muscle. In bone, it's about 1 to 2% of loss per month. So that adds on as you're in a very long-term mission. And then you can also measure this in the density and the weight of the bone. Your cardiovascular function is actually increased by 30 to 40% in microgravity. It's almost actually rising as soon as you get there with only in a week. So your cardiac output is very, very high. And you measure this in your VO2 or your oxygen levels, and then also the fluid shifts in your body. And you can see in the image here, so pre-flight, most of the blood is rushing down to your legs. When you're in flight, the blood is even throughout your body, it's distributed. So a lot of the blood will actually circulate up to your head, and you have this thing called puffy syndrome, so your eyes get really puffy. This affects your lymphatic system, which is your eyes, your eye movement, your vestibular system, which is your balance. There's a lot of taxing effects that go on in space. And then after that, you come back, your body's all messed up, and you just experienced a load of taxing effects. Well, now you come back and you're trying to accommodate back to normal gravity. So there's a lot of studies that have shown that that these taxing effects can be mitigated and also reduced. One form of countermeasure is electrical stimulation. However, there are very few studies that support this countermeasure, and that is one thing that I'm looking into. Objectively, I am looking to create a systematic review of 3 countermeasures: biogenic therapy, exercises, and electrical stimulation. So, main question: how can these methods prevent or reduce deconditioning while protecting functionality and capability between pre and post spaceflight syndrome? Here's some background. So biogenic therapy, you have drug therapy, genome therapy. There's a lot of therapies that involve your proteins and also your ability to live autonomously, your autonomic system. There's exercise. So there's some exercise machines up on the ISS that they're using. It's the only form of function that they can use, which is a treadmill, which serves as a weight as they're running and on the kind of fixed surface, fixed ground. And then you have a lifting machine, multi-axial loading machine. So it takes care of all the muscles going on in your body: squats, deadlifts, bench press, pull-ups, all that. You have biking, so that takes care of your cardiovascular system. So it's low impact, but you can go pretty fast, and you can also maintain that cardiovascular function and working for getting your energy levels and also your exercise. And then electrical stimulation. So you have regular electrical stimulation, you have transcutaneous electrical stimulation, you have functional electrical stimulation, and you have neuromuscular electrical stimulation. So when I went into my review, the purpose of my review was to research if specifically electrical stimulation could potentially serve as a control to mitigate these physiological effects, and potentially psychological effects too, because they're all intertwined with one another. Got to keep the astronauts in good, healthy conditions so they feel good. So there's a lot of review papers that I was going into when I started my journey. So the types of studies that I looked into, most correlated with spinal cord injury, cerebral palsy, pulmonary disease, which is your lack of blood flow throughout the body, which is a lot of what astronauts experience. Immobilization, which goes into, you're not using certain parts of your body, so your muscle is lost, and also some bone is decalcified. You have bed rest studies, which is on top of that. Space flight, you have short and long term. It gradually affects the taxing effects on long periods of time. You have rodent studies, so studies that really can't be performed on humans. It's not really safe, so they use rodents. And then you have lower body negative pressure, which actually sucks the blood from, well, it's like serving as gravity. So it's like sucks the blood down to your legs when you're in bed rest. So the blood can actually flow, and now you're in gravity when you're in space. And then comparing this to not only just one form of the musculoskeletal system, but three, which is your cardiovascular, bone, and your muscle. So there's a lot of papers that go into this. There's a lot of different forms, there's a lot of different studies. Each person likes their own way of doing their own studies, so I had to take in a lot. And there's very few studies on electrical stimulation, so I had to make some inferences. I had to kind of conjure some ideas, think a little bit creatively. And the types of studies that I was kind of mainly looking at was, to categorize my thoughts, was the type of stimulation, the electrode placement, usually found in the lower extremity. So when you have your lower extremity, you think of, there's a cathode and there's an anthode. So electrical stimulation can actually course through the body. This depends. So one form of achieving this would be placing it on larger muscles, so your type 1 muscles instead of your type 2, because the electrical stimulation will actually activate and recruit all motor units depending on what kind of parameters you use, such as frequency, pulse duration, amplitude, or intensity, your on-off times, which your on-off times increase depending on the kind of ratio you're using. So if you're doing a 1 to 5, meaning that you're going higher intensity and you're kind of taking some time off. And then if you're going lower ratio, then you're going faster movement, trying to hypertrophy your muscles. And then also ramp up and ramp down time. So you're contracting, you can't just automatically contract the muscles or you're gonna hurt yourself. So you have to slowly activate those fast twitch and slow twitch muscles, or your type 1 or your type 2 fibers, to then achieve that slow moving contraction. And then some keyword searches that I was mainly looking after was electrical stimulation in spaceflight, and also accounting for cardiovascular, bone, and muscle. Okay, so I have about, say, 2,500 papers that I was looking at. It's been a really kind of long time, and I'm still not done, but doesn't mean I don't have results. So when I get into my results, the main things that I found was that neuromuscular electrical stimulation is the main form of stimulation that we want to use or utilize when you're in space. It has the right parameters that we need to actually combat or mitigate these losses in spaceflight. So you're looking at long pulse durations with low intensity excite smooth muscle contractions. High intensity with low pulse duration can excite the strength of bone. So it would actually, the higher intensity would be able to pass through the muscle and actually excite the bone. And this would be more of like fast twitch. And then sessions usually occur in like 5 to 10 minutes of use. And it usually works best with isometric contractions, meaning that the length of your muscle is constant and you're having force being applied. And then usually, since we're looking at lower extremity, it has been found that your leg should start in a 60-degree angle to achieve the best motor recruitment. So some implications for EMS. EMS has been broadly validated in a clinical environment with spinal cord injury, cerebral palsy, and pulmonary disease, of combating these diseases and these effects of people on Earth. So we want to investigate how that can be implicated into an in-flight environment when you're in microgravity. Well, the in-flight training schedule, usually I work out for about 2.5 hours for 6 days a week. That's a lot of exercise for somebody that's also doing research on the ISS, and you're not going anywhere. You have to stay on the ISS. So could we think about this in a more passive way of mitigating these losses or maintaining control of your losses? That's one question that we're trying to consider. One form of maintaining these losses without strenuous activity could be done through hybrid training simulation modules. So when you're flexing, if we're looking at a bicep curl, so you flex your muscle, your bicep, it comes in, it's in contraction. Then you have, thumbs up. Finish. Then you have the load being applied in the contraction of the muscle, joint movement, electrical stimulation on the agonist side of your, which would be your tricep. So that is in the eccentric portion. So then you can actually have those slow twitch muscles without exciting the contraction of your bicep and possibly overloading it. So we're trying to just diminish the amount of exercise that can be done on the ISS to have these astronauts be more safe and comfortable and don't have to spend so much time with them. So future work, it would be investigating biogenic therapy and exercise more to be implicated for electrical stimulation, and this would involve doing 3 different systematic reviews. The one I'm doing currently is electrical stimulation, and those would all be combined together into one giant review. So I'm planning on submitting that going into next year. So thank you.